This is an interview with Dr. Thiti concerning facial surgery of the various kinds. So can you start please by explaining which facial surgery procedures you undertake, or you perform I should say?
Okay. You mean for transgenders, right?
For transgenders or non-transgender patients?
Okay. For transgenders, normally the working that I do is like a facial feminization. That means we want to transform the face from male to female. Normally it depends. The procedure is depend on individuals, because some might be we separate like three parts: the upper face, middle face, and lower face. If some might be the prominent, it might be the upper face, it's for around the forehead, but some might be broader chin and square chin that we might have to focus on the lower face. So actually it's individual. From some I did, but most of the cases that we do is about the forehead feminization.
Do you do type 3 foreheads?
Yeah, I do the type 3 foreheads too. But actually, in Asian, not everyone that need to do the type 3 forehead. Well, normally because the Asian, they like the forehead is a little bit more like a gray zone for male and female. So normally in Asian, they do just shaving of the brown, the upper brown, and maybe put a implant, forehead implant. That's enough. But if some is very sinus is very definite, we have to do type 3 forehead also.
So, considering that it's obviously serious surgery, is there any particular preparations that they should make before coming X-rays or?
Yep. If like type 3 forehead feminization, we need to CT scan to make sure that the frontal sinus is stick at the places, so we can do precisely for not injury go through the brain. So we have to focus on the area of the frontal sinus solely. And for the chin, normally we need to do the X-rays to make sure that how much that we have to remove to change the shape of the chin.
When you do the chin, do you do the incision through the mouth, or do you do the incision?
I do combine that, because we found that for V-line surgeries, if you do just only the inside the mouth, the angles around here might not very precise. There might be a little bit the asymmetries. Better to combine a little bit around here to make it more very symmetries on, especially in these areas. But for the here and the lateral, normally we can do it from the inside of the mouth.
And roughly how long post-operative would a patient need to stay in Bangkok to let things such as bruising and swelling disappear?
Oh, it's quite a lot. For if we wait for until all the swelling go down, like V-line surgery, normally the swelling might be a month or a little bit more. So normally you don't need to stay until all the swelling was gone, because at that area it's the depending areas, so it takes long time for the swelling was gone. But normally I want the patient to stay in the Bangkok around 2 weeks after surgery for that.
So they should stay
at least 2 weeks.
Usually about 2 weeks.
Yes.
And how long would they stay in the hospital? I know different procedures would take longer, but on an average for say a forehead?
Roughly around 2 to 3 days after surgery.
And then they just go home and recover at home?
Yes, go back to the hotels or...
Is there any particular preparations, recovery, such as bandages or anything that they would need to?
Yes, they need to use the bandage to compress and to reduce the swelling after that.
Okay.